So thank you very much for coming for this World Brain Day. And the important theme is brain health for all ages. So good morning. So 22nd July is the World Brain Day. It's happening all over the world. The theme of this year meeting is on brain health for all ages. So I'm talking on brain health for elderly people. So you could see that we started with the brain health for pregnant women, then brain health for growing children. Now we are going to cover the elderly people. So brain health refers to a person's brain functions across several areas. The brain health include cognitive health, how well one think, learn and remember, and motor function, how well one make and control movements, including balance. And emotional function, how well one interpret and respond to emotions. Tactile function, how well one feel and respond to sensations of touch, including pressure, pain, and temperature. And sensory function, how well one see, hear, taste, and detect odors. So if you see, so the components of brain health are cognitive health, motor function, emotional function, tactile function, and sensory function. So brain health can be affected by age-related changes in the brain. Injuries such as stroke or traumatic brain injury, and neurotransmitter issues, mood disorders such as depression, and disease like Alzheimer's disease and related dementias. These are the common issues which happens as we grow older, and it doesn't happen to everyone. But how to prevent it, how to keep the brain health safe is very, very important issue, and a lot of recommendations are given for that. Age-related declines commonly include overall slowness in thinking and difficulty sustaining attention, multitasking, holding information in mind, and word finding. Research indicates that age-related changes in the brain structure such as decreased hippocampal, frontal, temporal lobe volumes are a common aspect of aging that contributes to some of the thinking changes. Not all thinking abilities decline with age. In fact, vocabulary, reading, and verbal reasoning remain unchanged, even improve during the aging process. And I understand that what I am quite long time back and now, there are certain abilities I am much better compared to when I was young. So that as we grow older, it doesn't mean that we lose some faculty. In fact, some of the faculty become much more better. Mild cognitive impairment means that the cognitive declines do not affect the person's ability to carry out everyday tasks, shopping, cooking, and driving. It doesn't really show outside. They may feel that they are a little different from what they are before, but in fact, they will be able to carry out most of the activities. Dementia indicates those cognitive difficulties are impacting the person's ability to complete everyday tasks. Once only it become a problem, they come for consultation. Otherwise, they'll be able to carry out most of the activities. So the common things which all of us see in the private practice are getting lost in familiar places, repetitive questioning, odd or inappropriate behaviors, forgetfulness of recent events, repeated faults or loss of balance, personality changes, decline in planning and organization, changes in the diet and eating habits, changes in hygiene, increased apathy, change in language abilities, including comprehension. So a lot of this thing happens, and we have to see the environment. I think we are discussing about environment issues in every stage of our life. Suppose there is a good people to care us, there are people to interact with us, we get a healthy diet, and we are very happy, no anxiety, no stress, our mental health is very good. And most of this thing doesn't happen, and we do regular exercise, yogic practices. So it all depends upon how we design our life, how we carry out, and how much cooperation or care we get from the people surrounding. The risk factors of cognitive decline are type 2 diabetes, high blood pressure, midlife obesity, smoking, depression, little or no mental activity, little or no physical exercise. That's why it's very, very important. We have a beautiful profession. We practice until we are in this world, and most of the people practice So it is very important we are cognitively active and we learn new things that makes our brain more active. Maintaining the brain, mixture of good nutrition, physical activity, mental and social engagement will provide benefit in promoting brain health. It's very important social engagement, social networking, and interacting with people, talking to people. So we need to use all cognitive abilities to sustain a good brain health. And stay away from smoking. Smoking is an independent risk factor. Exercise at a moderately high level of physical activity. Exercise facilitates oxygen growth factors in the brain and helps modulate the brain immune responses. So, like pranayama, which I used to tell in the previous lectures, like pranayama, meditation, and a healthy diet, and doing some exercise, what we can do, like going for a walk. So, combination of everything will make overall the brain function better. So good. We have to go for a good routine medical care. I think most of the eye professionals, they're quite busy. In fact, they take care of others. They don't have time to take care of themselves. So it's very important that routine medical care should be given. Illness in the body affect brain ability to optimally function. So we have to make sure there is no specific illness in the body, like any vitamin deficiency or any uncontrolled diabetes or hypertension not getting monitored, BP is little higher side. So we have to make sure that everything is under control. Maintain excellent cardiovascular health, blood pressure, cholesterol levels. What's good for the heart is good for the brain. I think by taking care of the brain, we are taking care of the heart. By taking care of the heart, we are taking care of the brain. To build social support networks to reduce stress, challenge the brain, and share the aging process with other people who are experiencing the same changes and joys of entering into the later years of life. It's very, very important, the networking, talking to people. I think in the electronic era that people are interacting more with the electronic, I think that is not equal to the physical interaction. The physical interaction and talking happily and keeping the mind happy, a state of mindfulness will make the cognitive health very healthier throughout our life. Keep doing the activities that challenge you and you enjoy for as long as possible. Trying new activities may be a great way to challenge the brain to make new brain connections. For example, I was learning Bharatanatyam. I was telling people that I'm not going to do any Arangetram. At the age of 60, that's not going to be useful to me. But what is basically important is learning a new skill and executing what we can do. Not necessarily, we don't need to become the perfect piece or the best piece or the expert in the particular field. Learning just for the sake of learning, and which makes the brain more interconnected with the neurons are interconnected with each other. It makes the brain more effective. Gardening, playing bridge, walking, reading, or other activities that are complicated enough to involve the mind. But we should not add stress to life are very, very important. For example, when we are learning something new, as I was telling you, we don't need to be the best in that. But the mere process of learning, the happiness of learning, which makes us more effective in a day-to-day life. Maintain a healthy diet. Plan meals around vegetables and then fill in up with other foods. As a general plan, eat a variety of foods as close to their natural state as possible. Changing circadian rhythms and sleep disturbances are common as we grow older. As age advances, people tend to feel sleepy earlier in the evening. This may result in waking up early in the morning as our sleeping hours shift. Older people have less REM and less slow wave sleep. It may affect consolidation of memory. In addition to changes in the sleep cycles, older people are increasingly vulnerable to sleep disturbances that cause poor sleep and low brain oxygen. So it's very, very important that we give concentration to the sleep pattern. We have to go to, as much as possible, go to the sleeping time and have a nice sleep. And when we feel tired in between the daytime, also better to have some rest. It's very, very important to give more, because in the early part of our life, we would have worked very hard, not would have slept in the night, we would have slept very less time. Those things we should not do as we grow older, because that may affect our cognition and other aspects of life, like performance of other organs also will be affected in a poor sleep people. Research has shown that sleep apnea increases amyloid, a protein associated with Alzheimer's disease. People with Alzheimer's disease are prone to sleep problems, including insomnia at night and excessive sleeping during the day. Aging well means prioritizing sleep. Is very, very important as we grow older. I think after the corona that the many people, especially me, that I make sure that I go to bed in time, which I used to go very late in the early part of my life. Because the sleep is so important. It has influence on every organ in the body, because every organ is a separate rejuvenating time. So that it's better to go to sleep early and get from the bed that around 5:30, at least have some reasonable sleep without any disturbance. That's very, very important for effective function of the entire body, including the brain. Mental health promotion prevention strategies for healthy aging include measures to reduce financial insecurity and income inequality. We have to make sure that when we retire, we have enough resources so that we don't need to ask anybody. That gives us a feeling of security and feeling of happiness and feeling of self-sufficiency. Programs to ensure safe and accessible housing, public buildings, and transport. I think most of the developed nations, we see that there are buses specially designed for elders to get in, and the buildings are special. I think we are also coming to that, concentrating on how to take care of the people of special need, how to take care of them when they come to the society for other activities. Social support for older adults and the care. We need to have a very strong social support mechanism to give care to the older adults and the carer also, because the carer have equal stress compared to the people who need the carer. Support for healthy behaviors, especially to eat a balanced diet, physically active, refrain from tobacco, and avoid alcohol use. Health and social programs targeted at vulnerable groups, such as those who live alone or in remote areas and those living with a chronic health condition, like watching a drama, listening to the music, or people gathering, have a small game or play, like what Dr. Arulmoli was telling, for children, applicable to adults also, and older adults also. We need to have relaxation, which makes our life much more better. It makes our cognition and the ability of the body to function better. A society is measured by how it cares for its elderly citizens. Elderly people deserve the highest respect, says Dr. Paloma Gomez Campello, a psychologist and researcher, Assistant Director of the Hospital La Paz Institute for Health Research. This includes quality health care to allow for the best quality of life for the people who have helped to build the society we currently enjoy. We have to keep always in mind what we enjoy now is because of what has been left by our elders, our senior citizens. So it's very, very important to give respect to them and to take care of them. As I was telling in the initial first sentence in this slide, a society is measured by how it cares for its elderly citizens.